Welcome to the Canine Code channel. Your dog just vomited twice this morning. You cleaned it up, figured they ate something weird in the yard, and went about your day. Most people do exactly this. But what if that vomit, combined with 3 other signs you didn't even notice, means your dog has less than 48 hours before their organs start failing? What if the slight change in how they're breathing, the way they walk to their water bowl, and where they chose to lie down are your dog's only way of screaming for help? Subscribe now, because what you're about to learn could save your dog's life before dinner time today. Number 1. The breathing pattern that means internal bleeding. You've seen your dog pant after exercise 1,000 times. But right now, while your dog is lying completely still on the cool bathroom tiles instead of their usual bed, watch their breathing. If their abdomen is moving more than their chest, if each breath looks like they're pulling air from their belly instead of their lungs, if their gums are pale pink instead of healthy salmon, you're watching internal bleeding in real time. Research from veterinary emergency medicine shows that dogs instinctively seek cold surfaces when their core temperature regulation fails, which happens when blood volume drops. Your dog isn't hot. They're losing blood somewhere inside their body, and their brain is trying to compensate by finding coolness while their heart races to pump what little blood remains. Studies on canine hemorrhagic shock reveal that dogs can lose up to 30% of their blood volume before showing obvious distress, which means by the time you notice something is wrong, they're already in crisis. That abdominal breathing, technically called paradoxical respiration, happens because their body is shunting every available resource to vital organs, and the muscles between their ribs are getting starved of oxygen. Pet owners think their dog is just tired or hot. Veterinarians know that when you see belly breathing in a resting dog, you're looking at shock. This could be from a ruptured spleen, internal tumors, trauma from something that happened hours ago, or bleeding disorders. Every minute you wait, your dog's brain and kidneys are getting less oxygen. This isn't something that can wait until morning or even until you finish this video. Number 2. The combination of restlessness and stillness. Your dog stood up from their bed, walked 3 steps, lay back down, then did it again 2 minutes later, then again. But here's what you missed. Between those episodes of restlessness, they're going completely rigid, holding their body in an unnatural position. And when you call their name, their head turns, but their body doesn't follow. Behavioral veterinarians and emergency specialists have identified this restlessness rigidity pattern as one of the most reliable indicators of abdominal crisis, specifically gastric dilatation volus, where the stomach fills with gas and twists on itself. Published studies on canine emergency presentations show that owners almost universally describe their dog as acting weird or can't get comfortable in the hour before their stomach completely torsions. What's happening inside your dog's body right now is that their stomach is swelling like a balloon, pressing against their diaphragm so they can't breathe properly, cutting off blood flow to their spleen and intestines. And they're trying desperately to find a position that makes it stop. The restlessness is your dog's attempt to escape pain they can't locate. The rigidity is their abdominal muscles locking up to protect organs that are being compressed and strangled. Your dog isn't being dramatic or anxious. Their body is telling you that organs are dying right now. And within hours, that twisted stomach will rupture or their heart will stop from the pressure. Large, deep-chested breeds face this risk constantly, but any dog can blow. You're watching your dog try every position, every movement, searching for relief that won't come without surgical intervention. That subtle hunching of their back, that unwillingness to lie flat, that's not discomfort, that's agony your dog can't communicate any other way. Number 3. The sudden change in water drinking. 3 hours ago, your dog drained their water bowl in one session, something they never do. Now they're standing at the bowl, lowering their head and walking away without drinking. You refilled it with fresh water, thinking maybe it was stale. They're still not drinking. If your dog went from desperate thirst to complete refusal, especially if you also notice their tongue looks darker or stickier than normal, you're seeing either acute kidney failure or toxin ingestion. Veterinary toxicology research shows that many common household poisons, from antifreeze to certain plants to rat poison, create intense thirst in the first stage as the kidneys try to flush the toxin, followed by complete aversion to water as the kidneys shut down and nausea sets in. Your dog's body went from trying to save itself through dilution to being so systemically poisoned that the mere thought of water triggers vomiting reflexes. Studies on acute renal failure in dogs reveal that the window between treatable and irreversible is measured in hours, not days. When your dog stops drinking after a period of excessive thirst, waste products are building up in their bloodstream. Their electrolytes are spiraling out of balance and toxins are concentrating in tissues throughout their body. That sticky tongue means severe dehydration at the cellular level. The refusal to drink means their brain is so overwhelmed by nausea and toxicity that survival instincts are failing. Dog owners think their pet is being picky or the water needs changing. Emergency veterinarians know this pattern means your dog needs for fluids and blood work immediately because whatever is in their system is winning and their organs are losing the ability to compensate. Every hour without treatment means more permanent kidney damage, more neurological involvement, more systems failing. Number 4. The eye movement you're interpreting as tiredness. Your dog's eyes are doing something strange. They're flicking side to side, or one eye is pointing slightly outward, or both eyes seem unfocused and glassy. You think they're sleepy or zoning out. What you're actually seeing is called nystagmus or strabismus, and it means something is wrong with your dog's brain, inner ear, or nervous system. Published research in veterinary neurology identifies abnormal eye movements as early warning signs of strokes, vestibular disease, severe inner ear infections, brain tumors, or toxin exposure affecting neurological function. When a dog's eyes can't track normally, their brain isn't processing spatial information correctly, which means the systems controlling balance, orientation, and consciousness are compromised. Studies on canine vestibular syndrome show that what starts as subtle eye drift can progress to complete loss of balance, head tilt, circling, and seizures within hours. Your dog's brain is either being damaged by lack of oxygen, being invaded by infection, being compressed by swelling, or being poisoned by metabolic waste it can't clear. Those unfocused eyes mean your dog is losing their ability to orient themselves in space. That slight head tilt you thought was cute is actually your dog's brain trying to compensate for false signals about which direction is up. Dog owners miss this completely because eye movements are subtle and dogs can't tell you their world is spinning. Veterinarians recognize this as a neurological emergency because the longer the brain is compromised, the less likely full recovery becomes. Whether it's a stroke cutting off blood supply, an infection crossing the blood-brain barrier, or toxins affecting neurotransmitters, your dog needs imaging and treatment now while brain tissue can still be saved. Number 5. The hiding behavior that signals organ failure. Your dog is under the bed. They never go under the bed. You called them for dinner and they didn't come. You found them wedged in the back corner of a closet, or behind the couch, or in the bathroom behind the toilet. This isn't your dog being weird or playing. This is instinctive end-stage behavior that kicks in when animals feel death approaching. Research on terminal animal behavior shows that dogs seek enclosed, protected spaces when their bodies are failing because wild canine ancestors would hide from predators when too weak to defend themselves. Your dog's brain is interpreting organ failure as mortal danger and triggering ancient survival programming. Studies on liver failure, kidney failure, and severe infections in dogs reveal that the combination of toxin buildup, pain, and systemic collapse creates an overwhelming urge to retreat and isolate. When your dog hides in unusual places and refuses to come out, their body is likely in multi-system failure. That enclosed space feels safe to a brain that's being flooded with waste products it can't filter. The darkness and isolation match what a dying wolf would seek. Dog owners think their pet is scared of something or being stubborn. Emergency veterinarians know this behavior means your dog's organs are so compromised that instinct has overridden training, bonding, and even hunger. If your food-motivated dog ignores dinner to stay hidden, if your social dog won't come when called, if your loyal companion chooses isolation over your presence, something catastrophic is happening internally. This is often the last clear signal before collapse. The moment where your dog's body has moved from compensating to surrendering. Combined with any other sign on this list, hiding means you need to physically bring your dog to emergency care immediately because they're telling you in the only way evolution gave them that they're dying. Number 6. The posture that means pancreatitis or peritonitis. Look at how your dog is standing right now. If their back is arched, their head is lowered, their legs are positioned unusually far forward or back, and they look like they're frozen in a bow position, but without the playfulness. You're seeing what veterinarians call the praying position. This specific posture appears when dogs have severe abdominal pain, most commonly from pancreatitis or peritonitis, where the pancreas is digesting itself or the abdominal lining is infected. Clinical studies on acute pancreatitis presentation show that dogs instinctively stretch their abdomen by lowering their front end while keeping their rear elevated, because it's the only position that slightly reduces the pressure and pain. Your dog isn't stretching or playing. They're desperately trying to make room inside their abdomen for organs that are swelling and inflamed. Research on peritonitis shows that when infection spreads through the abdominal cavity, dogs will hold this position for minutes at a time, completely still, barely breathing, because any movement intensifies the pain inside your dog's body right now. Digestive enzymes may be eating through pancreatic tissue, or bacteria may be multiplying across organ surfaces, or leaked intestinal contents may be causing chemical burns to internal structures. That lowered head position reduces blood pressure slightly in the abdomen. That stretched stance creates more space for inflamed organs. Your dog has calculated through pure pain that this exact posture is the least agonizing option, and they're locked into it because moving hurts worse. Dog owners think their dog is doing a play bow or stretching after a nap. Veterinarians recognize this as a surgical emergency because both pancreatitis and peritonitis can kill within 24 hours through shock, organ failure, or sepsis. If your dog holds this position for more than a few seconds, if they're trembling while holding it, if they won't move when you approach, their abdomen is in crisis and they need imaging, blood work, and likely surgery or intensive care before the infection or inflammation becomes irreversible. None of these signs alone guarantees emergency. Your dog might vomit once from eating grass. They might pant from heat. They might drink extra water on a warm day. But when you see combinations, when 2 or 3 of these behaviors appear together, when your gut tells you something feels wrong, even though you can't name it, that's your dog's survival depending on your willingness to act on incomplete information. Veterinary emergency medicine operates on pattern recognition, and the patterns that save lives are the ones owners notice before they become obvious. Your dog is breathing strangely and seeking cold floors. Your dog is restless and won't drink. Your dog's eyes look wrong and they're hiding. These combinations are your dog's emergency broadcast transmitted through the only channels evolution gave them. When you rush to the vet and it turns out to be nothing, you've lost 2 hours and some money. When you wait and it turns out to be everything, you've lost your dog. Thanks for watching my video. Please subscribe the channel. Take care.